Hello, I'm Kirsty. I'm one of the midwives, part of the infant feeding team. We're just going to have a little talk to you about a technique that you can use if you find that your baby is reluctant, particularly in the first 48 hours of life. Reluctance to feed in newborn babies is really common, and we would advise lots of skin to skin with baby, keeping baby nice and close, and looking out for feeding cues. So if baby starts to root around or puts the hands in their mouths, are all signs to say, "Mum, I'm hungry." If you're finding baby is not wanting to feed, then don't worry. What we would recommend, like I say, keep baby nice and close. When you're supporting baby, if you make a U shape with your one hand, so the space between your thumb and your first finger, if you just bring let baby's head just fall back into that space, and you're sort of scooping baby up with your other arm, and then it frees up this hand then, and again you want to make that same U shape, so between your first finger and your thumb, let your breast just fall in between that space, so you're holding your breast as a U shape, and then with your thumb just above the nipple, just ever so gently press down on that, and you can see that that nipple has just curled round a little bit. So this part of the breast here is in like a curved shape now. So you're just simply going from that to that like that, okay? And then what you're trying to do with the curved bit of your breast here is get as much as that breast into baby's mouth as possible. So put that curved part of your breast down on baby's bottom lip. So you're trying to encourage baby to take as much breast tissue into his mouth as possible. As soon as he's able to do that, you can release your thumb then, and you can see that the nipple then goes from that curved to that. So the nipple then goes further back then into baby's mouth. So if you imagine looking into baby's mouth now, the nipple would go from there to there. So that nipple will be going further back into baby's mouth. What you can also do as well to encourage baby to latch on is actually hand express a couple of drops of your colostrum as well. So keeping your fingers where they are, so a good 2 to 3 centimetres back from the breast, you can simply compress and release, compress and release, and that will help encourage some drops of colostrum, which will encourage baby to latch onto the breast as well. Thank you ever so much for watching.